everybody. Let's do some stretching. I'm Amanda Valentine. I have with me one of the top personal trainers in the region, Josh Garrett. We also have a virtual physician from the Christ Hospital, Dr. Robert Kulwin. The first thing to test for is mobility.
First thing we're gonna do is we're gonna test Amanda's ankle mobility. So what we have is we have a tape placed 5 inches away from the box, or you could use a wall. And what we wanna do is we're gonna keep this heel on the ground. We're gonna have Amanda slide her knee forward and see if she can get to touching that box. And as you can see, we have a pretty good gap there, so we have some restriction going on in the ankle.
The ankle mobility test is a great way to determine if the range of motion in your ankle is where it should be. If you have pain with it, stop, get it checked out. But if it's just a little stiff, then it just shows you something that you can work on to improve the function of your foot and ankle.
So one thing that could be limiting the ankle mobility is the toe extension flex. And what we're gonna do with that is you're gonna actually just take something off the ground and just see if you can grab it with your toes and pick it up. Got it.
A lot of times after toe injuries, you can get stiffness, and it really can be bothersome. One of the things you can do is kind of practicing picking up various things with your foot, not just kazoos, but sometimes marbles or towel corners, and this can really help get out that residual pain and stiffness.
Next, we want to roll out the plantar fascia. That's the thick band of tissue on the bottom of the foot. You'll want to press on the ball and roll it around like this. And this will relax and loosen the tight and constricted muscles and ligaments of the foot. Next, you should take a foam roller or a stick and roll out your calves. You'll also need to roll out the front muscles of your shin. Go ahead and roll out all the hot spots that you can find.
The plantar fascia is a strong structure in the bottom of your foot that helps support your arch and also acts as a spring when you walk along. Rolling out like this can both help break up scar tissue that can cause pain and improve elasticity.
Then we want to stretch the calf. So what we're going to do is we're going to step up on a step. What you want to do is just let the heels hang off the back of the step, let gravity do the work. So gravity is going to be pulling the heels down. And you want to let this hang for about 8 to 10 minutes per day.
The gastrocnemius is a big muscle in the back of your leg and one that crosses both your ankle and your knee. Because of that, it tends to get tight as, to be honest, we sit around a lot more than we used to. This stretch, as your knee is straight, really helps isolate and lengthen that muscle.
After we get done stretching the calf, what we want to do is we want to mobilize the ankle joint. So what we're going to do is go down into a kneeling position. We're going to grab the arch of the foot, with a reverse grip. You're also going to hold the heel down like so. And then what we're going to do is we're going to slide that knee so that it comes outside of the elbow. As you're doing this, you don't want that heel to come up off the ground, so you almost want to think about driving your heel backwards as the knee's going forwards. You might get some popping and cracking in this position, but what we're trying to do is just mobilize that ankle joint.
Improving mobility in your ankle can help with prevention of all sorts of problems, including midfoot arthritis, plantar fasciitis, and actually even hammer toes.
And then remember, once you get done with all of this stuff, you want to go back and retest the ankle joint to see if you've gained any mobility. If you have gained mobility in the ankle joint, then you want to go ahead and strengthen those patterns so that hopefully you keep that mobility.
Thanks, guys. Yeah, like what Josh and Dr. Kulwin was saying, if you're doing these stretches and you're retesting and you're not seeing a benefit from it, or if you ever start to feel any pain, that's when it doesn't hurt to reach out to a specialist. And Dr. Kulwin is always available to help you out.